be yourself. If anyone was exactly like you, one of you would be unnecessary.
I also wanted to be a mom. And in those days, there weren't many women who combined both motherhood and professional life, although we certainly met a number of them at Hopkins. And there were people like those women who made me think, yeah, you can do both.
I was concerned about how the law and medicine treated families who abused their children, and eventually went to law school. And I combined the law school and medicine, the legal side and the medical side, to a career in public health, using the law as a sense of what you could do, what the authorities were, and how you could use those legal principles to get actions done.
Best piece of advice, I think, honestly, is to, and this is very cliche, but to listen to your patients. Since I practice primary care, that really is the essence of my job, is listening to their stories day in and day out. And if you do that well, you're 90% of the way to your diagnosis.
Listen to the patient, they tell you what they got. And it's trying to be what I described, to put what you're doing as a subspecialty or a specialty in relationship to the whole patient. I'd say, what was the draw? And perhaps we learned to work as a team.
The most important element of my department is the Ulster Medical House staff. It is the springboard for training of academically and clinically successful physicians. If you want to change things, you change it through the Ulster House staff.
There was a young man who was had some very significant psychiatric issues and come to the emergency department at Hopkins. And Dr. Tumulty was there, and I saw him. He spent 45 minutes or an hour just talking to this young man. And again, that taught me a lot about, being a physician.
Get knocked down, but bounce back up again, like the old song. You've got that heritage of excellence, that triad or a quad of experiences from the absolute top people in the world.